With so many types of hormone replacement therapy, or HRT, now available to women, it's become quite challenging to understand the differences between them and the terminology used to describe them. You may have heard people talking about using bioidentical hormones. Certainly, some of my recent contributors have spoken about why they chose them as their preferred option. And then there's the tangle between unregulated, compounded bioidentical hormones and regulated bioidentical hormones, which are also described as body identical hormones. Finally, there's traditional HRT. So if, like me, you're a bit lost in the jargon and would like to be clearer on the various options, then my guest today is going to help put us right. Dr. Liz Andrew is a specialist in women's hormonal health from the Menopause Care Clinic here in the UK. And today she very helpfully breaks down a complex topic to set out the difference between the hormone therapy options, why compounded bioidentical hormones are not licensed in the same way as other forms of HRT, and what that actually means. We'll also hear how the formulations of licensed and unlicensed bioidentical hormones differ, and we'll delve into the difference between the types of testing offered and whether there are any additional risks associated with the less regulated approach. Dr. Andrew, Liz, thank you so much for accepting the challenge of breaking down what is quite a confusing topic, not least because the terminology has become a little bit muddled. So I wondered if we could start just by running through the different options of HRT that are available to patients today and how you would define them. Maybe going back first to what's probably now considered more old-fashioned HRT options that were maybe kind of animal-derived. Should we make that our starting point?
Yeah, that's a good. I think it has become quite confusing, hasn't it, for women? And I see lots of different language used for quite often what I think of as being sometimes quite similar things or not that different or a little bit confused. And I know that we use the term HRT, and I'm really aware that that's quite a UK-based term, I think, and there are other parts of the world where they talk about MHT, or menopause hormone therapy. And I kind of think of HRT or MHT as being like an umbrella term for lots of different ways of giving back hormones or adjusting hormones. And we quite often talk about the old-fashioned types of HRT in the UK, and we're normally, if we're talking about that, so women might refer to that's old HRT or the modern types of HRT. And usually when we're talking about the older types, that's often tends to refer to particularly this one type which was created, the first type of hormone replacement therapy, which was derived from horses' urine. So when it was first created, the pregnant horses' urine contains estrogen, and so that was used to create one particular brand of HRT, which is, I think, still available, but called Premarin. It was very effective for lots of women, really supportive, but I've probably prescribed it near the beginning of my career, but haven't prescribed it for many years now. And then there is also this concept of oral synthetic, which is types of HRT, which are quite similar, I guess, to some of the older contraceptive pills as well. And they can be incredibly effective. And they're in this same kind of grouped together as this old HRT. And they can be really useful for women, actually. But they are manufactured, and they are hormones that are mimicking in a similar way, but not the actual hormones that are the main hormones that we're using. So you might see names like ethinyl estradiol, and they converted in the body when we take them, usually they're taken as tablets, into types of progesterone, into types of estrogen. And they're the types that we sometimes wonder about. Might there be a little bit more additional risk to do with blood pressure increasing or a little bit of additional clot risk. And there are certain cases where we might not think of them as much. But that's kind of how I box together, firstly, where HRT came from and this concern about animal derivatives, and then the kind of traditional older fashioned types of HRT. That's the way I think about where this has all come from. Some of the older contraceptive pills fit with that
And
as well.
are they all animal derived, the synthetic
No,
and
I
the
don't believe so. No, I don't believe so.
okay, they're just not quite as similar to our own hormones as some of the newer generations that we're now going to come on to, and that's where the
That's the
terminology
thinking.
gets a
Yeah.
little bit more tricky. So I guess we could put it within the traditional camp, as in what most of us might expect to be prescribed these days in gel form or patch or whatever, but by our kind of mainstream general practitioners or gynecologists. What is that? How would you describe that kind of HRT?
So I think there's regulated hormone replacement. I guess that's the umbrella term for
Perfect.
this kind of in the UK and within our national guidelines and by myself. So lots of menopause specialists. It's not just within the NHS, but often gynecologists, GPs, menopause specialists, endocrinologists working within mainstream medicine tend to use
Hmm.
what we think of as regulated hormone replacement therapy. And that includes the synthetics. So it includes medicines like, for example, in the UK, we have things like Femiston. These are newer types of oral hormone replacement that are synthetic, but they're regulated. And then there are what's often talked about as being body identical. This word has kind of appeared quite a bit. And the way I think of that is the estrogen is this 17 beta estradiol. So this is body similar, mostly through the skin, but there are oral forms of it as well now. And then micronized progesterone is often the type of progesterone we think of as this regulated body similar. And the body identical term has come about to differentiate it from this kind of bigger heading of bioidentical. And this is where all the confusion comes in, I think,
Yes, it
because you
is.
can tell me even trying to describe it is tricky, isn't it?
Yes, and I see it in my comments with viewers kind of arguing with each other over what it is because I decided to have this conversation and find an expert like you to have this discussion with because there was so much confusion around it, but also because I had noticed a run of influencers mainly, but people in the kind of healthy aging space who were all using what they described as bioidentical hormones, which are compounded hormones. We're about to have that conversation, that seemed to be outside of mainstream medicine. And that I thought had to be broken down and defined, which you're kindly going to do for us now.
So the term body identical is used in the UK mainly. I'm aware that often in the States, I don't think the word body identical is used quite as much. But it's something that within the UK, mainstream medicine, sort of menopause societies have used it as a term to delineate types of bioidentical hormones that are regulated. So within each capsule of the progesterone, within each bottle of the gel pump, within each dose of the spray, within each patch, you're getting the same amount of medication. They're produced within the pharmaceutical industry. The majority of the plant-based derivative, and they're all giving these bioidentical hormones, but in a regulated way, regulated within the pharmaceutical industry. And we like the idea of that, and that's what's promoted as a good way of prescribing by mainstream medical organisations in the UK and colleges, because the regulation allows for us to have a bit more understanding within licensing, within big research practices about exactly what's being given. And so it's felt to be a regulated, safe way of prescribing. And it's often the costs of lots of these medicines isn't overly expensive either,
Mm. Hmm.
fortunately.
Hmm.
Um,
So everybody gets a kind of standard dose, and there's a recommended sort of minimum, maximum dosage within that, and they're using. Um,
there's lots and lots of different types, and you can combine them differently. So you can listen to a patient's story and you can work out what might work for them based on their needs. But we understand a little bit more about what sort of dose of progesterone you would be giving that might expect to support the lining of the womb, what sort of dose of estrogen you might expect to, and if we combine this dose of estrogen, what might we do with the progesterone? There's a little bit more understanding. Or, for example, if we're going to use things slightly outside license, we've got a little bit more research that's gone into these particular formulas.
because
The
there's been quite a bit of, there's been a few clinical trials around them, data supplied in order for regulators to deem them safe.
Yes, yes, that's a good
Yeah,
way of describing it. That's a good way
yeah.
of describing it. It's a little bit more like we know really exactly, know more about what we're dealing with. So using it on a broad population perspective works very well as well.
Yes. Yeah. And I think that's a similar picture in quite a lot of countries where, all that data exists. And that's why these are licensed, regulated HRT options. And we've also got the bioidentical HRT options, which are not licensed and regulated in the same way, but which are being prescribed in some cases. And how do they differ? What are they? How do they differ?
So that concept then is about what's often termed as compounded medications. And medicines have been compounded for years for lots of it's used. Often a really common one actually is within the skincare and within dermatology, making up creams and ointments that have combinations of things. And that's been done for a very long time. So compounding within pharmacies it's become less and less with regulated medicines
And
actually.
is it sort of mixing active ingredients, which in this case is hormones, rather than just giving them individually, putting them together?
Yeah, in this case, making them up to a prescribed combination, and that might be available, for example, in a cream that's through the skin that's mixed, or it could be in a pessary form, or I've seen some women with lozenge forms, and they are the same hormones. The reason and they're sort of talked about as being a little bit more personalized, and sometimes the personalization, my understanding of it is comes from perhaps some blood testing. And for some women it does seem to work very well and is supportive for them. But one of the reasons at the moment within the UK, the main organisations currently don't recommend that way of doing it is because doctors generally and in science, we like evidence. We like to know that what we're doing is safe. And there is also an element of cost difference. So by making them compounded, quite often the treatments do seem to come at a bigger cost compared to the regulated ones, which the majority of them, they are accessible on the NHS or even privately. They don't have such big price tags. The reason that the compounded ones currently within the UK aren't recommended by the big organisations is because we're not always sure, particularly related to progesterone. So for women particularly who have their wombs still, the estrogen is often supporting lots of the symptoms. Progesterone might do in some women too, but the bigger role for progesterone when we're giving hormone replacement is if we give back estrogen, because it is supposed to be and is a stimulant of the lining of the womb as part of a natural cycle. Progesterone's its counterbalance, and if you add back estrogen, you should add back progesterone to keep that lining of the womb nice and in check, prevent it overgrowing, and possibly even in the long term adding to endometrial womb cancer risk. Provided these are in balance and we're not getting bleeding problems, there's no belief that long term or in research HRT adds to that risk. The bit that there's some uncertainty about is with the compounded hormones, where the progesterone is perhaps in a cream or a lozenge, is it definitely doing that job? It might be, but we're lacking in data to know that, and that's where the uncertainty comes from. And for things where there might be a little bit more risk, doctors tend to err on the cautious side, and so that's the current understanding with the compounded hormones.
So how much of it, say it's in a cream form, is actually reaching the bloodstream? Is that
That's what we don't know.
the concern?
Yeah.
And so with if I was prescribed a compounded, personalized, bioidentical formula, I could get a cream that might have estrogen, progesterone, and even testosterone all in the one cream.
That's what I don't prescribe these, but I've seen them. Yeah,
Yes. Yeah. And based around testing, where a doctor might look at that and say, okay, I think you need these specific dosages in this one cream I'm going to have put together for you. And that dosage might be an unlicensed dosage as well, which I know happens in mainstream medicine too. But these are the kind of parameters. We're putting different hormones together in one cream at different dosages that a doctor or prescriber is seeing as individualized for us based on regular blood
but
testing.
it usually appears to be based on regular blood testing. Yeah.
Yeah. Okay.
And I think that's also an uncertain part because regular blood testing, well, it takes time and it involves money as well to have it. Um, we do use blood testing sometimes related to the regulated body identical formulas and the synthetics usually, but it's a less big driver of decision making, and overall well-being tends to be the main factor. Listening to the story, making adjustments based on the story. The difficulty with blood testing is that the ranges for women vary a lot. So where your point of well-being might be different from where my point of well-being is. So there isn't a perfect number we're aiming for. And then particularly where estrogen's concerned, and in perimenopause and the early stages of menopause, there's lots of fluctuation. So it's just a
Yeah.
snapshot in time. And basing the decision about what dose of estrogen to give or on that blood test, it's a nice idea because we all like data and we like to think that, well, if it looks like this, I'll do this. But the reality of actually treating women and the ups and downs, it can be quite misleading that.
Because I suppose it could fluctuate even within a day. So my levels might be one point in the morning and different
yeah,
in the evening.
yeah, it can be different in a day. The other thing would be that the nature of perimenopause and menopause is change. So even if you said, well, I'm always going to take it on this day, if your cycle's changing, which is the nature of the ovaries gradually switching off and becoming less active, that day in one cycle will be different from that day in another cycle. So even going on that isn't really ideal.
Yes. I can see how attractive it is, for women who can afford it to have this regular testing, make maybe different types of tests that they're doing as well to arrive at this conclusion. I think everybody that I've spoken to who's told me they're using it kind of raves about it. Then the other side of that, I haven't heard from people who once used it and stopped using it, or so it's just a little snapshot. But I can see that it's becoming popular. It's becoming more spoken about, certainly among the kind of longevity biohacking,
Yeah, 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 yeah.
that kind of community seems to be talking about it
Yeah.
a little bit more. And it is confusing for everyday women like me and the people watching and listening who have been trying to get our heads around, well, what are they talking about? How
Yeah.
does that differ to what I'm being given?
Yeah, yeah, yeah. I think, I mean, by and large, the estrogen in them, the body identical estrogen in the regulated types that you would get from your GP or I prescribe, is the same type of estrogen that is in the bioidentical compounded
Yeah.
types. Um, the progesterone, the micronized progesterone in them is the same type as well. And if you do supplement testosterone, it's also the same testosterone molecule. So when we're talking about bioidentical compounded versus the body identical regulated types, we are talking about the same hormones. They're not different hormones. And choice can be a really good thing. And I think what you're saying about, there are more and more women choosing this, I imagine that to some degree it's about accessibility. So unfortunately, although I work with incredible colleagues and I have done within the NHS as well, the nature of an ever-growing population and women's health being put on the back burner for forever has meant that I think women haven't had access to supportive conversations that last long enough, adjusting their medicines regularly enough, being offered hormone replacement, which gets reviewed and adjusted for them.
Mm.
And what that then leads to, or sometimes even having conversations which should have been or could have been identified as perimenopause, but offered either nothing and it's suggested that it's because life's too busy or something else.
Mm.
And
Mm.
those sorts of conversations, unfortunately, then will have led to women looking for other ways to support what they probably know are their hormones. So lots of
Yeah.
women will say, I just know something's not right. Women do know their own bodies quite often very well. And so that's when they've then gone looking for another industry that's going to
Hmm.
support them. And
Hmm.
I understand that. I
Yeah.
think that is a large part. And then that can often come at quite big costs. I think in large part it's about hoping for things to be safe and women be able to access good care, but without too much influence from everything costing more and more money when you might not be on anything that's very much different too. So we see it the other way round, where some women come from having been on bioidenticals for a little while and aren't really sure if it's doing very much for them, and their symptoms have really started coming in, and they come and say, can you adjust these? And I'll explain, well, that's not the type that we're prescribing, but it's okay. We could try switching you to what we would prescribe. You might be able to then get it from your GP on one of these prepayment certificates we have in the UK, but I know it varies around the world.
Hmm. Hmm.
And we make some adjustments to try and put it over to the way we do it, but and some of them are quite surprised and will say, I've been spending this much money every month. And that's when I explain, even privately, what the cost of their prescription might be. They're quite pleasantly surprised usually. I think it's really wanting to open up conversations so that women at least feel able to access a supportive conversation with a doctor that allows them options. I think we've to be careful not to create conflict in this, because that doesn't help
Yeah.
discussion really. It doesn't help
No,
health.
we're not saying this good, this bad. It's just literally this is how it is at the moment. This is how the regulation works. And I think you mentioned when we talked a little earlier off camera that some of the carrier ingredients in the compounded bioidentical hormones can be a little bit different to the regulated ones as well. These are maybe slightly less tested too as a
Yeah,
result of
I
that. Is
think
that right?
it's less that they're less tested. It's more the
Okay.
idea that, so when the regulated ones have been tested and we've got, that means they're licensed, other companies can make generics of those, they're called. So they could produce the same, but they make them exactly the same. So same capsules, same ingredients. They have to go through a robust, if a company wanted to make the same medicine. We don't, for example, have a progesterone through the skin. We've got capsules regulated, and we've got vaginal pessaries, which can also be used rectally, that are regulated. We
And
have,
the coil as well.
there's the coil, but that is a different, so that's a good way of giving progesterone to the womb,
Yeah.
protecting the womb, but that is a synthetic type progestogen in it,
Okay. That's
actually.
the one I have.
It's brilliant. I do too. But with the women that have it, it works brilliantly. It's excellent at protecting the lining of the womb, sometimes smooth symptoms. But when we're having this conversation about body identical or not, it isn't that type. But that doesn't make it bad. It doesn't suit all women. It suits lots of women. It's got lots of positives. It's got some bits where this bit might be positive. We're all individual. We have to have options and what works for us. The compounded types that are through the skin, bioidentical compounded, we don't currently have a regulated progesterone cream, which means that there isn't a licensed, all the data about knowing
Mm,
how's it absorbed. And
mm,
so I guess my concern with the compounded creams with the estrogen is, well, it might be giving you good estrogen back, and that's really helping your symptoms. But what if that progesterone isn't being absorbed into your bloodstream sufficiently that it's supporting the lining of the womb and balancing the two out? It's possible it is, but the data for the licensing isn't there, which is where the caution comes from and where the statements currently mean that we don't in the UK recommend them. But it
yeah.
could be that one day we've got enough data to say this is also a really good way of doing it. And
And
we
it joins the mainstream. Yeah.
and these, I mean, I think there will always be in medicine different ways of doing things and different doctors that have different experiences. There's very unlikely to be one recommended way of doing anything. The nature of medicine is constantly new ideas, new moving forward. Sometimes what the new idea is, 10 years down the line, it becomes apparent it wasn't such a great idea. We should pull back and move forward with this idea.
Yeah.
But
Time will
it's,
tell.
yeah, time will tell.
Yeah.
But having options and finding a doctor that will listen, I think, is a big part of it.
Yeah. So that at the very least, we can be guided by our symptoms. And when something's out of sync, have access to a doctor and be able to have a conversation that helps us get that balance
Yeah,
back in
yeah.
check in an
And it's whole
affordable way.
holistic, yeah. And it's
Yes.
thinking about hormones, but also thinking about the rest of the body, because we are more than just our hormones, and there's that part changing and can be supported. But there might be other things going on as well, or how kind of how we live our lives might need to adjust a little bit,
Mm.
thinking about our guts, thinking about everything together, really,
Yeah.
and putting it all together. And that's, I suppose, that's what these terms like personalized or individualized care, we've to be careful not to always think that that means that's all about a blood test that tells us exactly the
Mm.
doses that we should be on, because there's a lot more to us than just a blood test that tells us our individualized doses. And listening to
Yeah.
the whole picture and adjusting doses as well as thinking outside the box about what else is going on with your sleep, with your food, with the way you live your life, with your relationships, everything, all as a whole during this time of change, I think is really important.
That makes a lot of sense. And you have explained something very complicated and tricky beautifully, because I feel like I really understand that now. So thank you so
I hope you
much.
understand a little bit more anyway. I think it is a really
Definitely.
confusing topic. I think it is.
Yeah. Yeah. Thank you. I so appreciate it. I hope you'll come back.
Oh, thanks, Claire. I'd love to talk again.
So if you found this conversation helpful, do let me know in the comments, and I'd love to hear your experience too with either compounded bioidentical hormones or another type of hormone therapy. Maybe you've tried different forms and can shed some light on how they compared. And of course, hormone replacement therapy is not for everyone. Some people just don't like the idea of it, and for others, it just may not work out for them. I've just switched from gel to patches to see if it would improve side effects for me, like headaches and stomach upset, and I'm still not in a terribly good place with those side effects, and that's at a low dose. So some of us are just more sensitive to these types of therapy, and if that's you, I'd also like to hear your experience. As I said, not everyone wants to try it, but it would be good to see more women have the choice. So I'd also be interested to hear how easy it is for you to access HRT or hormone therapy where you are in the world, because there's so much variation between healthcare systems. Just to flag before we finish that in the description below, I'm going to include links to a couple of other related interviews that you might be interested in. And if you haven't already, I would love for you to join me more regularly on the channel by hitting subscribe alongside the notification bell so you can spot future episodes. Below, you're also going to find links to my website, honest.scot, where I share articles around healthy aging, and you can sign up to my free monthly newsletter rounding up all my latest content so you don't miss a thing from me. But for now, thank you for being here today.